the tooth form itself. And that's the characteristics of the lines, the curves, the contours that permit us to identify and differentiate teeth. Okay, one of the other things we need to look at is the proportion. And we know that from various studies that there is a pleasant proportion of width to length, and that pleasant proportion is anywhere from 70 to 80% width to length ratio of anterior teeth. And I've overlaid a chew template here, and you can see this central that I created is approximately 72% width to length, and this is considered pleasant. Now, one of the other things that we need to look at teeth when we evaluate them is the long axis. And the long axis is defined as a theoretical line passing lengthwise through the visible center of the body of the tooth. It's important to understand some simple rules. Right? The long axis of anterior teeth point towards the belly button, and this is a rule to keep in the back of your mind as we move forward. The important thing about the morphology of the tooth is the line angle. This is defined as the point of convergence of two planes on the tooth surface. And if you look at the lines, colored lines I've placed on this tooth, they represent different line angles. And what's fun about line angles is this can also influence the way a tooth looks to us. So in traditional tooth arrangement setups, you could create, say, a more ovoid shaped tooth if you use the red line angles. You could make the tooth appear more square by using the blue line angles, or more triangular by using the green line angles. What's equally important to understand about line angles is this is going to affect how wide or narrow the tooth looks to us, because the light reflects off the facial surface and reflects back. So if we move the line angles further apart, like in the blue, the tooth will look wider. If we move the line angles closer together as the red lines, a tooth will appear narrower. So we can do something like this, and this will help us create the illusions that we're trying to achieve when we create a smile. It's important to understand what we're striving for. We're striving for composition, okay? And what we really want are symmetry at the midline. Okay? Our centrals have to look like mirror images of each other. We want good proportions, not necessarily the golden proportion, but it's important to understand that whatever proportion we pick, that we repeat it. We need to focus on the balance and the dominance of the centrals. We need to set up the smile. These are all considered cohesive forces, and this is what creates the composition for beauty of a smile. You know, there's an old saying, if you want to get really good at occlusion or aesthetics, get really good at complete dentures. So I want to start with a classic article by Lombardi, The Principles of Visual Perception and Their Clinical Application to Denture Aesthetics. And understand what Lombardi was focusing on, elements that create cohesion. He defined composition as cohesive forces, right? We want to unify what we're seeing. And he defined cohesive forces as repetitions of shape, color, and lines. And the arrangement of these elements in composition in a definite pattern is also considered a cohesive force. Following principles, as we're going to outline, are how we create this cohesive force. And interestingly enough, one of the most important things that we often forget is that the presence of a border is a cohesive force. Not only the outline, the framing of the lips, but the gingival display as well. So in Lombardi's perfect world, we would start in aesthetics and denture construction as we would establish a midline. Once we've done that, we create horizontal space allocation. Central and lateral spaces are set up. And what's important to understand is that there is a ratio, right, to each other, central to lateral. And it may not, again, be the golden proportion. What's important to understand is whatever ratio you create, that you need to repeat this ratio as we move distally, so that the same ratio occurs central to lateral, lateral to cuspid, cuspid to bicuspid, and so on. Once you've established that, you want to create your aesthetic A point, the vertical space allocation. You want to place your incisal edge, and we typically do this to the smile. And once you've completed that, now you can assign tooth shapes. And this is where you can play around a little bit. But in a perfect world, you know, when we can control everything with the denture setup, this is what we strive for. And finally, the last balanced cohesive force is the gingival display as well, and it can work in harmony with the lip display. Lombardi also spoke to the balance of pairs, and as an example, he used a pair of discs, and he placed them in different places on a square. And when you place the pair in the center, he noted this lends balance and stability to the way we look at it. And why is that? Well, when you look at the two discs on the left, right, they don't look balanced. The two discs on the right do look balanced. And the reason is the way we visually look at things. Our eye tracks across the space. So when they're apart, our eye is tracking up, down, diagonally, sideways, and so we get a lot of visual confusion. When they're placed right next to each other, there's balance because our eye is not moving around. And this is the way we evaluate things. So when we look at, say, two centrals, if one of them is not in balance or in symmetry and harmony with the other, okay, it looks confusing, it looks restless, it looks unfinished. It just does not look right. So let's take an example of what I'm talking about. So this young man came to me, it was like a third opinion, and he wasn't happy with his smile. He was post-orthodontics, and he was really unhappy with his centrals. And he'd been to a number of dentists, and he got treatment plans from doing 2 veneers to doing 4 veneers to 10 veneers. And, we spent a little bit of time talking, and it became really apparent that all we had to do is understanding tooth morphology, is make one little change. And that's what we did. So let's work through this thought process. So let's create the outline of these teeth. And let's look at them without the rest of the background. And you can see that there is no balance. There's no symmetry to this. Well, what's wrong? Well, the apex is in the distal third of the tooth, the height of contour, and it looks pretty good. But when you look at the line angles, okay, the teeth aren't lined up. They're not symmetrical. They're certainly not pointing towards the belly button, but they look very crooked. They don't look like they're balanced. Well, how about if we look at the outline? It's not too far off. It's a little different. But what's really making this look wrong? It's the incisal edge position. So when you take a look at this and you draw perpendicular to the left central, you can see that this makes the tooth look like it's crooked. So what was the solution? Well, the solution was some simple reshaping. I just simply reshaped the incisal edge of the central. And now the centrals are more balanced. They're symmetrical, and this makes the eye happy. Again, the proportions of the teeth don't fall into the golden proportion, but yet this is a very pleasant smile now, and the patient's very happy. And all we simply did was do a little minor tooth recontouring. So it's important we understand the definitions of symmetry and balance. Okay, symmetry relates to objects viewed on both sides of a central axis. In other words, the closer teeth are to the midline, the centrals, it's important, it's critical they be symmetrical. If they're not symmetrical, the look is wrong. Balance is observed as the eye moves distally from the center. So as we move away from the midline, we want balance, but it doesn't have to be symmetrical, and that's an important thing to understand. And so a lot of other authors looked at what makes aesthetics. Ward talked about the recurring aesthetic dental proportion, or the red proportion. And what he's noted is that if we set up some properly designed, symmetrical, well-balanced centrals, proper width to length ratio, that as we moved distally or moved laterally, that we could have different proportions of the widths of the laterals to cuspids. And it could be anything from, say, 80% width, which still looks pleasing as you step down, to down to the bottom, 62% as you move in width, as you move distally, which is the golden proportion. So the trick is balance the centrals first, but maintain whatever proportions from lateral to cuspid and continue it as we move distally. Gradation is a critical concept to the overall look of things, and gradation is simply any change that occurs in a gradual manner. And so when we look at things, when we create an image, if we're going to make a two-dimensional image, we set up perspective points, right? So it's real easy to do. And so Lombardi talks about this, that the front to back progression is a critical factor because it creates not only the illusion of arch shape, but arch depth, and this provides a balanced composition. So when you have, say, a bicuspid that is too short, or one that's placed too far buccally, this violates this gradation principle. So if we highlight it, make these teeth whiter and outline them in the red, you can see how it doesn't look quite right. And conversely, right, you can have a bicuspid that is also too short, or one that is placed too far lingually. And this violates this principle of gradation and balance. And this is why oftentimes you hear presenters in cosmetic dentistry talk about never do 6 teeth. And when Denzel Washington had his teeth redone, he only did the front 6 teeth. And you can see not only from the frontal view, but from side views, that this creates a pinched in buccal corridor, that the bicuspids look like they're too far in, and it makes the front 6 teeth too prominent. It's not a very good look. And this is a consideration in denture and tooth aesthetics.